Hello class, my name is Marlyn Villalona and my issue is, will biomarkers for Alzheimer's disease be a good tool for life planning? My answer is yes. Now what is Alzheimer's disease? Alzheimer's disease is a progressive disease that deteriorates the memory and other important mental functions. It is now the sixth leading cause of death in the United States. Alzheimer's is the most common form of dementia. There is no cure, but there are treatments that can help some patients with the signs and symptoms. What are biomarkers? Biomarkers are a measurable substance in an organism whose presence is indicative of some phenomenon such as disease, infection, or environmental exposure. The category of medical signs which define a medical state from outside the patient and can be reproduced and measured accurately. Biomarkers can determine which therapies would be most effective for an individual who is diagnosed. An example of a biomarker is body temperature for fever. Blood pressure also determines the risk of stroke. Levels of cholesterol found in blood are biomarkers for coronary and vascular disease as well. All of these can be measured somehow. Will biomarkers for Alzheimer's disease be a good tool for life planning? The answer is yes. Biomarkers have the potential of providing an early Alzheimer's disease diagnosis before the symptoms show. Like neuroscientist Norbert Malinsky believes, an early diagnosis will allow for treatments and interventions which can be highly valuable to the patient. It might provide insight into the course of the disease and lead to steps that can be taken to prevent the disease. It can also facilitate research into possible treatment. Furthermore, it can allow people who have the disease to plan the remainder of their lives accordingly. In continuation, with increase in knowledge, biomarkers are being developed for better diagnosis by the research community for Alzheimer's disease. The established biomarkers for Alzheimer's disease include amyloid beta, tau protein, and phosphorylated tau. Alzheimer's disease patients tend to exhibit a pattern consisting of low beta amyloid and high total tau, as well as an elevated phosphorylated tau. Using biomarkers will allow us to be able to predict more accurately which treatment and prevention strategies will work in people who have Alzheimer's disease, as we can now do in cancer, heart disease, and other chronic diseases. What are some downsides of using biomarkers for Alzheimer's disease? Diagnosis and treatment of Alzheimer's can be very costly. If the tests are not reliable, it can lead to unnecessary treatment and mistakes in life planning. Early diagnosis can create discrimination and shame against those who are diagnosed. There are also no easy tests. Cerebrospinal fluid from lumbar punctures produce more consistent results. However, this screening can be painful and invasive, as it is known as a procedure of taking the fluid from the spine in the lower back through a very hollow needle. Should biomarkers be used despite being unreliable? Autopsy findings suggestive of Alzheimer's disease are commonly found in people who never had symptoms. Telling patients that they are at risk rather than they have preclinical Alzheimer's disease can lead to rational life decision making. However, if the patient does in fact have Alzheimer's disease, not labeling them early can allow setbacks in their life planning. Based on the utilitarianism theory, using biomarkers for Alzheimer's disease is for the greater good, preventing the greatest amount of suffering. Now, planning your life after being diagnosed with Alzheimer's can be considered as a type of suffering for the diagnosed and for the loved ones of the patient, since it is one of the leading causes of death.